Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Reactive hypoglycemia after eating. Reactive hypoglycemia, also called postprandial hypoglycemia, occurs when your blood sugar, blood glucose, drops after eating. This sugar crash usually occurs within a few hours of eating. Why it happens is still under study, but it typically resolves quickly with a small amount of food or drink, like orange juice, or with glucose gel. /r/n/r/n People who don't have diabetes experience reactive hypoglycemia, but they may be more at risk of developing diabetes if factors like a family history are present. It can occur after bariatric, weight loss, surgery or, rarely, due to insulinoma, endocrine tumor. Sometimes, though, an episode of reactive hypoglycemia can occur with diabetes due to exercise levels, or when too much insulin is taken before a meal. /r/n/r/n illustration by Alex Dos Diaz for Verywell Health /r/n/r/n Hypoglycemia is the medical term for low blood sugar, with symptoms that typically occur when glucose levels drop below 70 milligrams per deciliter of blood, mg/dL. /r/n/r/n Common symptoms of reactive hypoglycemia include /r/n/r/n Reactive hypoglycemia occurs after a meal. Its causes are different from hypoglycemia that occurs due to fasting for long periods without food, or in most situations where people diagnosed with diabetes are working to manage their blood sugar levels. /r/n/r/n The symptoms of reactive hypoglycemia are rarely life-threatening but may be a sign of an underlying medical condition such as Addisons disease. If severe symptoms occur, seek immediate medical care. /r/n/r/n If the drop in blood sugar is severe, seek immediate care if you are unable to reverse symptoms with glucose gel or a rapid-acting food or drink. Severe symptoms of reactive hypoglycemia include :/r/n/r/n You also should notify your healthcare provider if you are having reactive hypoglycemia episodes more often, even if your symptoms are not severe or life-threatening. /r/n/r/n Triggers for reactive hypoglycemia can include eating high-carbohydrate meals or snacks. One theory as to why it occurs is that when a person eats carbs with a high glycemic index, the body produces enough insulin to combat hyperglycemia. /r/n/r/n However, the body is not prepared for a crash because glucagon, which can counteract the action of insulin, is not adequately produced. Therefore, when blood sugar does go down, the body does not bring up the sugar by gluconeogenesis or glycogenolysis, which are processes that produce blood glucose from stored materials in the body. /r/n/r/n Health conditions other than diabetes that are known to cause reactive hypoglycemia can include /r/n/r/n Reactive hypoglycemia can be diagnosed using an oral glucose tolerance test, OGTT, or a mixed meal tolerance test, MMTT. /r/n/r/n The OGTT includes only glucose. The MMTT is performed by feeding each person a beverage rich in protein, carbohydrates, and fat, such as Ensure or Boost. Glucose and insulin levels are then assessed. /r/n/r/n The healthcare provider will look for results, often called the Whipples Triad, that include /r/n/r/n Results from tests used to diagnose hypoglycemia also can help your healthcare provider to rule out other possible causes of the symptoms, including mental health concerns like anxiety. /r/n/r/n Treatment for reactive hypoglycemia will depend on the cause. In many cases, blood sugar can be corrected quickly and people don't need medical treatment. However, if the symptoms are recurring, they may be the result of an underlying condition that needs treatment. /r/n/r/n If you have an episode of reactive hypoglycemia, you can use food to help restore normal blood sugar levels. /r/n/r/n. This is accomplished with the 15-to-15 rule, which involves eating 15 grams of fast-acting carbohydrates and checking your blood sugar 15 minutes later to see if the levels have normalized. The American Diabetic Association recommends /r/n/r/n. Once your symptoms have eased, have a snack if your next meal is more than an hour away to prevent your blood sugar from dropping again. /r/n/r/n. For an underlying medical condition, the treatment will focus on resolving or managing the condition. This may include the surgical removal of an insulinoma or, in the case of NIFs, the partial removal of the pancreas. /r/n/r/n. Certain dietary and lifestyle changes may reduce the odds of a reactive hypoglycemia episode, even where the cause is not yet known. You can try /r/n/r/n. Talk to your healthcare provider about your symptoms and lifestyle changes, as it's possible that medication or other measures may be needed. 2. /r/n/r/n. Reactive hypoglycemia is a drop in blood glucose, sugar, that occurs after eating. Symptoms usually develop within a few hours of consuming food and may include shakiness, dizziness, nausea, rapid heartbeat, and sweating. Severe cases can lead to fainting or seizures. /r/n/r/n. Reactive hypoglycemia can occur for other reasons beyond diabetes. The treatment typically involves eating fast-acting carbohydrates that can quickly bring blood sugar levels back to normal. /r/n/r/n, rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.